Asthma is a complex disease. A lot of people refer to asthma as an inflammatory disease of the airways. So there are a variety of different treatments. Unfortunately, you can go from a very mild case of asthma to very severe asthma. Most of these require the inhalational medications. People refer to rescue inhalers, people refer to albuterol bronchodilators, and then there's inhaled corticosteroids. That's usually some combination of these medications that are required to keep people under control with asthma. Bronchial thermoplasty is kind of interesting. When we look at asthma, it's talking about the inflammatory cascade, basically meaning that there are one series of events leads to the next, leads to the next, leads to the next, and eventually will lead to bronchoconstriction, the closure of the airways. Now that closure of the airways happens with a type of muscle which is in the airway wall, known as smooth muscle. Bronchial thermoplasty goes, I guess you could say, to the root of the problem, goes directly to that smooth muscle. And what happens is that we use this technique to eliminate the smooth muscle. Bronchial thermoplasty goes to attack the issue of this airway smooth muscle. We use something called radiofrequency ablation. What radiofrequency ablation is an energy form, in essence, similar to a microwave. When you put a cup of coffee in a microwave, you accelerate the molecules inside the coffee, and that's what heats it up. It's not actually like you're putting on a stove and heating it. So radiofrequency ablation, in essence, works similar to that, where we accelerate the molecules inside the airway wall and heat them up. When we heat them up to a certain temperature, it actually starts causing tissue to kind of fall apart. The more complex the tissue, the easier it is to fall apart. Well, the most complex tissue in the airway wall is pretty much the smooth muscle. So when we heat it up to a certain temperature for about 10 seconds, what we do is we cause the stability of that smooth muscle to break down, and in essence it decompensates and kind of falls apart, so that there is very little of it left in the airway wall when we go back and look at it. The idea being that by using bronchial thermoplasty, we can diminish the bronchoconstriction, in essence the problems a lot of patients get. Smooth muscle in the airway wall is thought to be vestigial. Basically, kind of like your appendix. It's there. It may have been important during embryonic development, but as an adult, we don't see what the absolute uses are for the for the smooth muscle in the airway wall. People who have asthma get frequent exacerbations, which leads to a lot of bronchoconstriction. Bronchoconstriction repetitively is like you going to the gym and just doing curls for your biceps day after day after day. Eventually, the muscle gets bigger and thicker. Well, when the muscle gets bigger and thicker in the airway wall, it actually starts to compromise the airway wall, and not only does it gets stronger, so it can cause worse bronchoconstriction. So these patients get persistent problems that can continue on and get worse and worse and worse over time. We found great success with the treatment. We've been following our patients now 4 to 5 years after the treatments here, and all of them are doing phenomenally. They're using reduced medications. They haven't been had to go to their doctors, no hospitalizations. We've really been able to get great control over what used to be a very problematic issue for these patients.